Hello, everybody. Welcome. Now, today we are going to see one clinical case in horses. First, we are going to see the history parts of the horse, and then we'll see the clinical finding, and then we'll list the differential diagnosis. What will be the differential diagnosis, and what will be the tentative diagnosis based on the history and the clinical finding, and what will be the treatment for the that cases, and finally, what will be the prevention and control measure for that disease. So let us start on the history part. The owner complained that the case was started before 3 weeks with swelling, discharge, and skin wound on the right front leg. Then it goes to the lateral and medial hind leg, and there is also swelling and lesion on the chest wall. There was no any treatments and vaccination before this time. The animal was free grazing on the pasture. The other horse were affected like the same case in the cavalry. So when we take the vital signs, the body temperature was 37.7, heart rate was as you see, respiratory rate also 12 breaths per minute. So the body condition is good and visible mucous membrane is pink. So clinical sign and other finding, skin lesion is present on the chest and limb. The skin is swelled and become thickened and hard. And finally, nodule rupture and discharge on the skin was found as a clinical finding. So, okay, based on the history and clinical finding, what will be the differential diagnosis? So the first one is the epizootic lymphangitis, and then strangle, ulcerative lymphangitis, glanders, and spirotrichosis. So first, when you see epizootic lymphangitis, it is well known that it is a chronic granulomatous contagious disease of horses caused by histoplasma farcinosum. So it is clinically characterized by suppurative, spreading dermatitis and lymphangitis. So strangle is the next one. So it's caused by the Streptococcus equi, subspecies equi. It mainly affects the upper respiratory tract and lymph node of head and neck. Especially it affects submandibular and retropharyngeal lymph nodes. So glandular is caused by the infection caused by the Brucardia malae, and it also affects upper respiratory tract like the strangle. So ulcerative lymphangitis is the third one, which is caused by the Corynebacterium pseudotuberculosis. It affects the lower limb, marked by the presence of nodule and ulcers containing blood passes. And spirotrichosis, which is just not found most of the time in our country, Ethiopia, or uh, just there is no any history for spirotrichosis. It is non-contagious chronic infection disease in equine caused by Spirotrix shanke. So it is characterized by cutaneous nodule and ulcers in limb with or without lymphangitis. So the tentative diagnosis is that is epizootic lymphangitis because it is a chronic granulomatous contagious disease of horses caused by the histoplasma farcinosum, clinically caused by ulcerative, suppurative, spreading dermatitis and lymphangitis. So it occurs following the uh, lymphatic vessels. Now let us see the treatment part of the epizootic lymphangitis. So the drug of choice for epizootic lymphangitis is that is amphotericin B, and we use also potassium iodide. But we have different steps to treat the horses. First, we are going to wash the wound or lesion by water diluted potassium permanganate, and then we apply normal saline together with paraffin, typically applied on the wound. We use also 10% povidone iodine is applied typically by using gauzes, and then to prevent secondary infections we use pen strips. And finally, we will give grisfulvin, which is antifungal drugs, and that prevents the growth of the pathogen. So the treatment response is that is poor because poor management and follow-up of the case, and long incubation period of the disease, and high resistance of the causative agents. So the most important part is the control and prevention part of the epizootic lymphangitis. So horse should be protected from flies and housed separately from another horses. Infection premises equipment must be thoroughly cleaned and disinfected. Systemic treatment with iodide, such as potassium iodide orally uh, for 7 days, or we may use sodium iodide uh, intravenously until the patient cures. So, elimination of the infection by using killing infected horses and preventing spread by hygienists. So, the final prevention and control measure. Thank you very much for all about the physical phages, especially where we are concerning on the treatment part, and the control and prevention part is very very important, because this is not cured. So the control and prevention part is the very important part of the physical phages part. Thank you very much.